What is up, everybody? Jimmy from the RT Clinic here, and today I've got some special products from some locals in Indiana, some oxygen products, and we're gonna get into them. The Oxyllow team's here. Let's go. All right, everybody, we're back and we have this new product from Oxyllow. This is the Oxyllow system, and it's really kind of inventive in the way it's been come up with. Actually, you may see a lot of our patients have, or maybe some of your family members have. It's wearing that oxygen cannula while they sleep. And so, for one, it's extremely annoying. For two, there's always breakdown that can happen on the top of the ears, which is really hard to heal. And then also on the face. Well, this system actually helps to deliver oxygen to side sleeping patients. And you can imagine this is for side sleeping patients, but it actually adheres to a special pillowcase, and the oxygen is delivered directly to the patient. You can see this patient is not doing well because they're extremely pale, but this is a testing system we have set up that we can actually check FiO2s, or that's the fraction of inspired oxygen that's coming to each of these patients. The patient's oxygen actually runs from we're running from a flow meter in this case, but it'd come from their home device. It's gonna come through this system here, and this is actually really nice and soft, and it adheres via Velcro to the pillowcase. And so what actually happens in this case, oxygen comes through, it comes through a diffuser right here and diffuses at the patient's face. When this diffuses, this has been tested that it actually shows quite a bit, the same FiO2 that's delivered nasal cannula actually comes to the patient, and in this case delivers down this system we have set up that's going to show FiO2 getting down to the patient's lungs. So specific, it's made for patients laying on their side. Obviously, one on both sides. This tubing comes out, kind of bifurcates in two different ways so that if the patient is on either one of these sides, these side sleeping patients, it's going to work really well instead of having that cannula on. Now, this is a product definitely for home, but it's something that's actually available right now. Obviously, first time you try something like this, we definitely want you using a pulse oximeter to make sure your oxygen level stays up. This is for those people that are on those low oxygen flows at home while they're sleeping. But a really cool product, really nice and soft in a lot of ways, and then it also delivers that oxygen directly to the face. So if you know someone that has issues with breakdown, their face, or their skin is delicate, if you will, because it can be that way. This is a great product for somebody like that, that's sleeping at home, laying down flat in a bed. But there are some other products that I'm going to show today also that are specific to the way we see a lot of our patients sitting up in chairs and sleeping. Let's get to some of those. I have Anthony here from Oxyllow who's going to show a little bit more about the device and how it can be used.
So we're going to turn on the oxygen, the continuous flow. And with the Oxyllow system, we've got it set up on both sides, but what we find is a lot of patients, they prefer one side, or they know exactly how they sleep. And because of that, we have some patients that set it up on just one side or the other, and the tubing comes where it's wide to either side. So whatever your preference is, I mean, we obviously test it where it's set up on both sides. So as we turn on the oxygen, we can look at that FiO2 when someone is laying as a side sleeper, and we use the lung system that we built to demonstrate the fraction of inspired oxygen. So we're using an oxygen sensor from Griesinger, which we take the little sensor as our if someone had deep in their lungs what their oxygen's going to be, and what we've done is we've rigged an ambu bag so that as it pulls through the system, we can read what oxygen's actually getting into somebody's lungs. And so when someone lays their head on the bed and they're side sleeper, and they have to be within 3 inches to get that similar FiO2 as they get from their nasal cannula. And if we're going to simulate someone when they sleep, it's about a breath every 8 seconds. And you can see it takes a couple seconds to get up to what that FiO2 is, because what ends up happening is that oxygen will build up in front of that patient's face as long as they're within that 3 inches from the diffuser head.
And this is another product from the Oxyllow team, super exciting. If you know a COPD patient, or maybe you have a relative this one, or you've been taking care of COPD patients, how do they like to sleep at night? Almost always sitting in a chair, right? And that's pretty normal. So this is actually a way to deliver oxygen while they're sleeping in a chair, and is specifically with a mask, hooks up to their concentrator, and comes through this, uses a neck pillow that specifically attaches to the mask. And so this is great for patients that might move a little bit also, because that mask is going to stay right in line with them. So instead of having nasal cannula on that's pulling on the ears or pushing up on the septum, they're going to be able to have this, almost this oxygen right in front of their mouth and their nose, which is another key. Commonly, some of us, including myself, unfortunately, breathe through our mouth sometimes when we're sleeping. So the neck pillow goes around, oxygen tubing, the same oxygen tubing that's used for their nasal cannula, would plug into this mask on the Oxyllow system and be held like this within a ½ inch of their face in these cases, and it's actually cause like a plume, if you will, of oxygen that they'll be able to intake during this time. So you can see, instead of having that cannula real tight, this oxygen is going to be delivered right to the patient. This has been tested up to 3 liters, which is what most patients are on, 0 or 1 to 3 liters that you'll see most of them are on at night. But as you can see, as the patient might move in these cases or turn or whatever it might be, you can see that mask stays right in place. The alternative to this would be have straps going around holding that mask. Those straps get weak. There's all kinds of other problems that we see them in the hospital all the time. But this is actually really nice material that helps to hold this here and then allow the patient to be on oxygen without having the cannula in. And there's another adaptation to this that I'm going to show you right now. And from the Oxyllow team, they also have this adaptation that's, I feel like it's even better than this mask in a lot of ways. This, if you're a respiratory therapist, you've been working in the business for a while, what does this look like to you? Face tint. And so this actually is a way to deliver oxygen. We do this in the hospital, but with this adaptation, it can be used at home. Using the neck pillow, the face tint actually would go on and oxygen tubing is added into it. With that, this one needs to be a ½ inch to 1 inch in front of the face, running 1 to 3 liters or so, but it's got a really cool option to it, and I'll see if you can hear it. If you've done this before with oxygen tubing, you've seen it put on there, and it takes a lot of force to kind of get that on, and you never really know if it's where it needs to be. This system actually has a clicking mechanism, so it goes on the inner aspect, and you'll hear the click. Again, that it's in and held really tightly. So it clicks, and that's how you know that your oxygen tubing is held tightly. With this one, and this is really especially nice for those patients that may have feelings of claustrophobia or whatever it might be while they're sitting down, so that their eyes have clear vision. Obviously, this could be used with glasses if they're watching TV or whatnot. And this has got to be within a ½ inch to 1 inch of the face, because that's going to give that oxygen that they can take in through their nose and through their mouth. So I'm really excited about these new products coming out. Some have hit the market, some have not yet. Keep your eye out for Oxyllow for these things. This is the Oxyllow Universal. And then we have the Oxyllow system that we showed a little bit earlier on the pillow. But these are awesome products. Reach out to the guys that have made these. They'll answer any questions you have. They've done a lot of testing, but I really think it is going to revolutionize the way we deliver oxygen in the home and make it more comfortable for patients, because that's what it's really all about, is making it comfortable for them so they can get that oxygen that they need, not through the old techniques. So sometimes we got to change things up a little bit, and I think it helps a lot. And you'll probably agree that most of your relatives, if they're sitting up or sleeping, they'd really like a product like this that would deliver oxygen to them, not through the standard nasal cannula.
Hey, it's Anthony. Just a little bit about ourselves. Like, we really started on this journey to help people get oxygen, and we started with our side sleeper version, and now we've got our back sleeper. So no matter how you sleep, we're trying to make oxygen therapy comfortable, so that way it's easy to stay compliant and to use your oxygen throughout the night. So we've done a bunch of testing with these products, the system and the universal, and what we have with that is we have the FiO2 at different ranges and different distances from the product. And so you know, in the video or in the description, we'll have the breakdown from 1 to 5 liters as to how those products perform. So that way you have a reference for how well those products translate to your home oxygen therapy.
Thanks for watching. Make sure you like, subscribe below. I'll also link the Oxyllow team below if you're interested in any of those products. I'll see you later.
I got a fire in me. You're gonna set to burn.